Good afternoon, everybody, and thank you very much for inviting me here. I'm very excited. I've been working in Gloucester City Council as service manager for sports development for 6 years, but actually have a health background. I qualified as a nurse it was in the 70s, anyway, it was a long time ago, but have always been interested in sport. I was one of the first action sport leaders. Of those that were in sports development probably know what that is. One of the first sports development officers employed in Lincolnshire. I've worked quite a few places around the country, but in Gloucester City, the Sports Development Service sits within our Customer Services and Leisure service, if you like, in Service and Neighbourhoods Directorate, which is very new, again with another restructure. My service is actually split into two parts. One is sport and physical activity, and one is health and physical activity. And I'm here today on this side, on the health side of it. And although they're quite specific and have specific areas, they do work very closely together. At the moment, there's myself, and I have 2 full-time officers and 1 part-time officer. I'm the only one that's employed by Gloucester City Council. The other 3 are employed but funded externally through a huge array of other partners. The Police, the Crime and Disorder Partnership, Barclay Spaces for Sport, Football Foundation, Community Partnerships, and I could go on. There's just a huge array of funders. And these are some of my leaders here. Within the presentation, I hope to show a snapshot of health initiatives and physical activity programs that we offer to help improve health inequalities, increasing participation, and changing lifestyle behaviours. I just thought I ought to show you where Gloucester is, because it's surprising how many people actually don't know where it is. We're sort of on the cusp of Wales and South West, and obviously the Midlands, or they call it the South Midlands, I think they call it. And just to show you our next few slides, I thought I ought to show some proper graphs and things, just to show you the challenges that we face. These are taken from the Joint Strategic Needs Assessment, and just to let you know that Gloucester covers 1.5% of the county's total area, has a population of 115,000, not a big city at all, which equates to 19.6% of the total county population. It's predominantly an urban area, but we have the highest percentage of residents living in the most deprived quintile compared to the rest of the county, which is 25.1%. And as you can see, I'm just showing the red line there, shows that in 2025, 16 years, there is a huge surge for our ageing population. Sorry, I'm getting stuffed here. Okay, this graph shows the estimates and current projected population by age and gender. Gloucester is forecast to have a population increase, as I say, by 2025 of 12.4% in those aged 19 and under, and a 39.8% increase of those aged 65 and over. And these are the proportions of children, adults and older people over the next 16 years. We have the highest proportion of BME population in the county, and this is 8.16% of the population compared to the county average of 4.9%. And this just indicates that our other, of those of you that don't know, the other districts in Gloucestershire is Cheltenham, Cotswolds, Forest of Dean, Stroud and Tewkesbury. I just thought I ought to show this, and I do apologise about this bit here. I actually got this from NHS Gloucestershire and I couldn't do anything about it. But it was just an indication of the areas that we actually concentrate our work in. And the red areas are the 10% most deprived, and the amber area is the next 25%. And although we do try to work in all areas of Gloucester, these are obviously the ones that we concentrate our efforts. Okay, this is one of our instructors actually, who delivers in our sheltered housing, would you believe? Obviously changing people's current lifestyles, improving confidence and learning new skills, and overall improving health and well-being of our residents is a major concern to everybody and a challenge. And the programmes that we offer at the moment, working with a variety of partners and organisations, agencies and individuals, contributes to the improvement in giving people more choice on their doorsteps. Okay. This is what we can offer. It's very diverse. My job as a manager is hugely diverse because our council is shrinking and I tend to get dumped on quite a lot with other things that probably have got nothing to do with sports development at all. As I said before, it's split into two, sport and health side. And although that some of these areas are quite specific, we do work very closely together. These are the programmes, or some of the programmes. I haven't listed them all because there are many. These are some of the programmes that we offer on our health and physical activity side. And hopefully I'll be able to go through and just give you a snapshot of each of them. Okay, I'll put Your Best Foot Forward is our own brand, but we do link it to the National Walk Programme. Currently, we have 12 regular programmed walks. They're free of charge across the city. We have 30 local people trained. We have an in-house trainer as well. Over 230 people have attended, with many reporting regular core groups. We also have had reports from people who've improved mobility and do other more regular walks. Again, the Fresh Start programme, missing one, Street Games, I'm going one. Street Games is a national programme. It's excellent, it really is, and it's offering free activities on our local parks and open spaces all year round. It's not just termly, it's all year round. The benefits include reducing obesity, building respect in the community, improving lifestyles, confidence and self-esteem. It does decrease crime and disorder, and we have evidence that it also improves antisocial behaviour. The stats as from May of this year, 751 young people have registered. We've delivered it in 12 community sites. Over 700 hours have been delivered, and over 30 coaches and 30 volunteers currently operate on there. We also do lots of events in our communities, and this one was what we called Healthy Pastimes, and working with the NHS Gloucestershire and our health improvement facilitators. This was to give people opportunity to try new things. This was a group of Bangladeshi ladies who had never, because they didn't have permission from their elders, to come out and participate, but we got permission. They came to try short mat bowls in one of our leisure centres, absolutely loved it, and actually have taken it on board. And they now have a little club of Bangladeshi mums, daughters, aunties, grannies, whatever, doing short mat bowls, which is excellent. We also always try to find community role models. The young man here in the red shirt, is one of our coaches, but he's also very well known in the community because he used to coach for Cheltenham Town Football Club, and he's respected out there. So we use him as a community role model to help improve things in our communities. We also work with the BTCV, the British Trust of Conservation Volunteers, and we have green gyms. Again, working out in our communities